Announcing the TR2 Patient Alarm, available exclusively from AliMed, the leader in fall management and patient monitoring.
Hi, my name is Ray. I've practiced as a nurse for years in both long-term and acute care settings. I know firsthand how hard we work to ensure that our patients are safe and that the risks of falls are as close to zero as possible. With this in mind, the TR2 was created with direct feedback from people like you and I, nurses, therapists, and caregivers. The TR2 has high-impact rubber bumpers that allow it to be dropped or tossed without worrying it'll break or shatter. The alarm was designed to handle the abuses of the clinical environment. When you take the TR2 out of the box, it is set to idle. This is kind of like sleep for your computer. Once you slide the switch to the load position and insert the sensor cable, an indicator light tells you the alarm is activated. The TR2 lets you know with light and sound if the batteries are about to go. What do you do if you go into a multi-patient room at night and you need to figure out whose alarm has gone off? The TR2 will flash when the alarm is triggered. The major weakness of most systems is the ability for the patient to pull the plug out of the alarm. If the plug is ripped out of the alarm, it will sound. Most importantly, if your patient engages in high-risk behavior, it will sound until you come or the patient returns to a safe position. The TR2 uses lock and load technology. Simply plug the wire from your pad or strap into the alarm. Slide the lock in place and the alarm is set. The lock and load switch also keeps the sensor cable in place while providing strain relief. Since it wraps around the cable, it actually keeps the cable from being unplugged or ripped out of the socket by a patient. Now let's talk about the hidden dual reset. The alarm remains activated until you turn it off with a hidden dual reset button. Located here on the sides beneath these rubber bumpers are the reset buttons. This yellow sticker points to them, and it should be removed once it's in use. If your patients exhibit unsafe behavior, the alarm will go off until either you reset it by simultaneously hitting both of these reset buttons, or your patient hears the alarm and decides to return to a safer position. Now that we've gone over what makes the TR2 so advanced, I want to review some of the special extras. First, I'm going to remove the battery cover. You will note the clip here is super easy to grasp and won't pinch your fingers. The screw has been specifically designed not to fall out when loosened. Once the cover has been pulled away, you will see 3 alarm settings. Depending on how far away you will be and the ambient noise level, you can set tones from 85 to 100 decibels. To help you differentiate the TR2 from other IV and pump alarms, you can even set the type of tone you'll hear. If you have a very high-risk patient, you can set the delay to 0. If you have a patient that you want to give a little leeway for repositioning, you can set it for 2 seconds. The alarm is shipped with Duracell batteries, but batteries don't last forever. If your batteries begin to fail, the low battery light and tone will alert you. The TR2, like other alarms, is going to check battery level, but to conserve energy, it will check battery levels every 20 seconds, giving you up to 4 times more battery life. From the lock and load switch to the rubber bumpers, the hidden dual reset button, to the special battery cover, the TR2 is dependable and perfect for any situation. The TR2 is truly the most versatile patient alarm available. Use it with sensor pads or seatbelt systems. The multi-purpose TR2 works with all of them. Remember, the TR2 features always-on technology. You never need to remind your staff to turn it on before leaving a room. It can withstand years of tampering or abuse, and you can only get this from AliMed.
All TR2 alarm systems can quickly alert a caregiver to help prevent falls. All AliMed fall management products are shipped complete with easy-to-read instructions. This in-service presentation has been provided by AliMed, the leader in fall management and patient monitoring. This presentation is not a substitute for proper training. However, it is your first step in establishing an effective fall management program. The TR2, it's always on.